Welcome to Wake Up with Nubian Tigers Talk. Nubian Tigers are a group of people who met at Princeton University and have continued to be friends throughout the decades. The COVID-19 pandemic and the civil demonstrations following the murders of Breonna Taylor and George Floyd by the police motivated us to harness our life experiences and professional expertise and contribute our voices to the broader discussion of the conditions of life throughout Black America. My name is Michelle Jacobs, and I'm with my co-host, Ray Smaltz. Before we get to today's guest, I'll turn it over to Ray.
Thanks, Michelle. And for those of you listening for the first time, the acronym WAKE, or W-A-K-E, stands for Wisdom, Advice, Knowledge, and Engagement. And the UP is the abbreviation for Princeton University, but only backwards. When the late civil rights icon and longtime Congressman John Lewis was only 23 years old, he delivered an inspiring speech at the historic March on Washington in 1963 and punctuated the end of it with, "Wake up, America, wake up, for we cannot stop and we will not and cannot be patient." This podcast aspires to wake up our listeners to some of the very same struggles within America today and across the globe. And Michelle, having just completed our election special series, one of the most important issues on the ballot this fall will be the Trump administration's management or mismanagement of the coronavirus or COVID-19 pandemic. As of this recording, America has upwards of 9 million citizens infected with the virus, while over 230,000 have lost their lives. Of that total, according to the COVID-19 Tracking Project, over 40,000 Black people have died, which is about 1 in every 1,000, or twice the rate of white Americans.
To conclude our COVID health discussions, we are joined by all three of our guests, Dr. Beverly Sheppard, Dr. Katrina Peters, and Dr. Janice Herbert-Carter, to share their thoughts with each other while Ray and I continue to raise questions about COVID's impact on our Black and Brown communities. Okay, well, now we're all back together, and as you guys listen to each other, I'm wondering if you have comments to make about what you heard from each other during the conversation, or whether there's something you can add or supplement to what was already said by our other guests.
You know, it was such a whole array of topics that, you know, I was putting the amen on so many things that were said, you know, just in relation to testing. And I was just thinking about how in children, we weren't testing back in between March and I'd say June, July. We didn't test children at all because it just seemed like they weren't a risk. So we're really beginning to get data on children and, you know, how it's going to impact, you know, our communities going forward. So we are doing more testing now. You know, there's been controversy back and forth between CDC and the American Academy of Pediatrics, who to test, when to test. But I think, you know, we're pretty much solidifying those recommendations. You know, we're trying to test. I personally am testing anyone who requests it, but certainly children who are symptomatic, those children who have been in close contact with someone who is documented COVID positive, and those children who have been to an area where there was a high transmission rate, where the community positivity rate was high. I'm testing those children, as well as children who are going for pre-procedural testing, just clearance for, you know, their surgeries or any invasive procedures that they will be undergoing. So, you know, testing is becoming more available now, but there's still, as Katrina mentioned, there's still issues with supply and demand. We still have those ongoing issues. And again, we have national leadership plays so much of an important role in all of this. You know, when I would listen to Katrina talk about the differences in the counties, you know, when the counties are all doing the same thing, you can sort of push, you know, your rates down because everyone's adhering to, you know, the precautions. But when you expand that to a national level where one state is doing one thing and another state is doing another thing, it's going to be very, very difficult to get a handle on this without strong national leadership. I really, really feel that way. You know, every day that I walk into my office, I have a new list of states that are under the travel advisory, if you will, averaging about 35 states per day that, you know, who, when they come to New York, they're supposed to quarantine for 2 weeks before venturing out. And we know that that's not happening. You know, I have patients sitting in my office who say to me, "Oh, I just got back from Georgia," and it's like, "Did you quarantine for 2 weeks?" You know, "Oh yeah," and it's like, "Did you or didn't you?" But there's no surveillance. There's no, you know, real follow up on these patients.
I remember you talking about that, how your patients were scheduling their school medicals, health checkups, and they, "Oh, we'll be up from Atlanta next week."
I've done some virtual visits where the child is in Atlanta visiting her dad, and mom is like, "Well, she's going to fly in tomorrow, and I'll have her see you the next day." Nope. I will see her 2 weeks from, you know, when she lands in New York City. But, you know, those are hard to catch. So, as I said, it's going to be difficult to control this virus and really push the national infectivity rate down unless we have a clear-cut policy across all 50 states of what we're doing and how we're managing this.
What's really tragic is that there was a national pandemic response team that was part of the CDC who had like a 219-page manual about what to do for a influenza type of pandemic that was developed during previous administrations. And this administration chose not to even open the book and throw it out, and basically have been a poster child for what not to do.
Right.
I think that book was right next to the one that the Obama administration left them.
Right, that they threw out.
Yeah, I think it was created by the Obama administration.
Yes,
It was. If I recall,
He's being sarcastic.
you know, and if I recall, when the Ebola outbreak took place in Africa, and we were concerned about the potential threat to the United States, in my office and in my medical group, we had training. We had videos that we played. We sort of mocked what would happen if someone came in who would travel internationally with symptoms of Ebola, how to put on the PPE. The PPE was there, how to isolate the patient, all of that. We were ready. Luckily, you know, things were abated. We only had a few cases here in the United States, but we were ready and we were prepared and we were teaching and we were educating. Proactive, we were being proactive as opposed to reactive.
Mm.
For instance, I think we're doing more reactive as we see these horrible numbers just go up and up and up. Are we talking north of 200,000 deaths in the United States from COVID?
Because this administration has absolutely refused to follow the science that is known. There's many things that we don't know about COVID-19, but there are a lot of things that we do know about public health responses and how you're going to, for a contagious disease. This is not the first contagious disease we've had. There's been many of them, okay? And there have been public health responses. Now, over the years, public health departments have been greatly reduced in terms of for their funding and their function. So that's another way in which we weren't really ready. But it could have been possible for nationally for them to ramp some of those up. Every area of it was botched. The PPE situation, people were not, it wasn't in the supply chains. They could have had it made. There were a few American manufacturers, but this was a worldwide pandemic. So nobody has extra PPE to send to the US, okay? So there were just so many areas. You had, you know, the president's son-in-law who knows nothing about any of it, who convened a task force of other college students and other know-nothings about government procurement to try to procure the PPE for this country. And in many cases, they paid millions of dollars for things that they never got, for untested and unvetted manufacturers. So every sector, there was no coherent plan. And so then they were only forced to do reaction. So we were forced, different states, to come up with their own plan, and then even different areas in the states, just to try to preserve the people who are there. But there are many things that can't be done on that limited a basis in a country that's as wide open as we are.
Of course, that was all designed by this administration, though.
Yeah.
Yeah.
I mean, just even the personal costs that many people have had to pay, you know, for people in more Black and brown people were not able to work remotely, even though I'm fortunate to have a job, okay? But I'm considered essential worker because I have to go to the hospital every day. Every day I've been at the hospital, okay? So the personal tragedies that people have had to go through, people have had to go through life changes, funerals. You can't go to funerals. I couldn't even, because of all the travel restrictions, even though my mother died in New York, I got to New York in time to cause the, at least for her to get ahead of the rush for cremation, but I was never able to return again to New York because either you couldn't go to New York because New York was going to require you to quarantine, or California was going to require you to quarantine. Then I tried to go, I was going to take it to Washington, D.C., which is where she was going to be interred. But hey, I'm not welcome in Washington, D.C. either, and California. So that's just one person, but this has been a national tragedy that has happened and touched so many families.
If I could, you springboarded me to my next question for all three of you. So for the first time in the 200+ year history of the New England Journal of Medicine, the editors published a political opinion piece describing America's response to the coronavirus pandemic. Our leaders have failed that test. They have taken a crisis and turned it into a tragedy. Unquote.
Yes, I read that article yesterday and I shared it with everybody on the Leadership Council at Morehouse School of Medicine. And not just they published it, but it's only the 4th time in the 200 and I believe 8-year history of the New England Journal that every single editor signed off on it.
That's something.
Unanimously. But that shouldn't be surprising because these are people of science and medicine. And the administration has completely ignored science and medicine, and you see where we are.
There was a scientific journal that actually came out and endorsed Biden behind this, something they had never done before. I can't recall the name of that scientific journal, but they actually made a political statement and endorsed a presidential candidate. That's how dire this whole thing is. And when it's this bad, of course, as we all know, if it's bad for them, it's even worse for us.
Yeah.
Absolutely.
I want to turn this a little bit different because I left out one thing that I think is important to mention about Black people's susceptibility to COVID.
Sure. Go.
We have seen that the data shows that vitamin D deficiency may predispose you to more severe COVID infection. It's not going to make you get it, but if you get it, it may be more severe. And
why is that?
Nobody knows yet why. But the relevance to Black people is that in this country, almost every Black person, unless you're already taking a vitamin D supplement, almost every Black person, almost every Black person who's not taking a supplement is vitamin D deficient. We don't get the sun, because that's how you make vitamin D naturally, is from sunshine. And we live at latitudes where there just isn't that much sun, or we may live where there is sun, if you're in, like, say, Florida or California, Southern California, but we try to stay inside in the air conditioning. So we're not out in the sun. And so the amount of sunshine that a white person can get in 15 minutes to make vitamin D, it would take us an hour. So melanin protects us somewhat from skin cancer, but melanin also blocks the rays that enable you to make vitamin D. So vitamin D deficiency is rampant in the Black community, and it has been shown that vitamin D deficiency predisposes to worse outcomes in COVID. So that's one more thing against Black folks in terms of COVID.
Whew, if you get up and breathe in the morning, you're susceptible to COVID. That's essentially what it is if you live in the Black community, right?
I'm moving down to Antigua.
I thought it was
They won't let
Barbados.
you in.
Hey,
I'm
there are a
sorry.
lot of
I'm
islands.
sorry, Barbados. That's right.
Yes,
You're
we
right.
know.
They ain't letting you in.
Ireland.
No, right.
Not
They
going
won't
in
let us
Ireland.
Islands
in.
for inviting people to stay for extended time periods, even if you don't get your second passport.
Yeah, we need some place where we can get some sun, apparently.
And even for myself, they tested me for vitamin D back in February, and it was undetectable. So,
Yeah. I don't even, as a physician, I don't even test people. I just say, take the vitamin D because it's so non-toxic. You have to take so much for it to be toxic. It's so non-toxic, but so many people are deficient. I don't even bother to test. I'm just like, oh, you black? Here, take vitamin D.
Is
And
it
it's
D3?
over the counter. So
Is it D3? Which D?
yeah. Mhm.
D3.
Mhm.
Yeah. No, it's pretty amazing. I don't know if Beverly remembers, but I was quite ill a couple years ago, and it turned out, and I got tested for cancer, for autoimmune disease, for diabetes 10 times, I think. But it turned out to be vitamin B12 deficiency,
B12, yeah.
and then after that, I developed a vitamin D deficiency. So it's amazing to me that vitamins, things that we don't pay any attention to,
Mhm.
could actually, one, make you ill, and two, aggravate whatever condition you get if you otherwise get ill with something else. So I think that's another issue that our community needs a lot of
Nutrition.
education on. Yeah, because we
Nutrition.
just don't
Nutrition is
appreciate.
big. Yeah, nutrition.
Yeah,
Yeah, nutrition.
Yeah.
yeah.
Mhm.
And you're a professional person, you work hard, you're running. When do we sit down and have a proper meal so that our nutritional values are where they should be?
But then let's get into, I know this is kind of not COVID, but when you talk about nutrition, so many Black people live in food deserts
Yes.
Right.
where they don't have good supermarkets. And
Right.
it doesn't have to be Whole Foods. I'm talking about just your basic supermarkets.
Mhm.
They have the corner store.
Right.
We've started an initiative at Morehouse School of Medicine. It's called the Corner Store Initiative to encourage corner stores to have, in addition to, those pickled pig feet in a jar and those big jars of dill pickles and eggs and full of salt, fresh fruit,
Mm.
some fresh veggies, so that people can get healthy food in the so-called corner store.
Yeah. Yeah. So people may not be aware that here in DC, in the southeast part of the city, in the 8th Ward, the grocery store there burned down during the riots in 68, 69. They just got a grocery store in 2015.
Wow.
In 2015. So one of the approaches that they're using here in DC is they're giving coupons for fruit. So you receive your coupon and you can go to any grocery store and exchange the coupon for fresh fruit and vegetables. And it's an experimental initiative that's been going on here in the city, but it seems to be getting some traction. So, it's a creative way to try to deal with this issue of food deserts, right? But Ray,
Yeah.
you had a last COVID question I think you wanted to get
Well,
to.
I just wanted to bring it back to our guests regarding the increase of COVID, especially in the Rust Belt areas. Wisconsin is going through another increase. Ohio, Utah, both of the Dakotas. And, as physicians and as teachers, what would you guys say to your patients and your students right now as we are approaching the flu season with the double whammy, as you guys mentioned, of COVID?
Get a flu shot.
Yes.
Okay.
Flu
I
shot.
had the flu in the 80s and I swore never again. Okay. It's bad.
Mhm.
And COVID is worse.
Right. And
So
I just like
get
to
a
speak
flu
to,
shot.
yeah, absolutely. Janice is absolutely right. And I would just like to speak to what has transpired since March when we shut down. Vaccine rates in children nationally dropped by well over 40%. Parents were afraid to bring their children to the pediatrician, afraid to get those routine checkups, afraid to get that assessment of their overall growth and development, afraid to get the vaccines. So, my message to everyone is, your pediatrician's office is safe. you should call your pediatrician to ensure that safety guidelines have been put in place. We've done a lot of policy changes and a lot of changes within our practice to ensure that we get patients in, we get them out. We've even measured the size of our waiting room to determine what is the capacity of patients we can actually have in the waiting room where we do not jeopardize social distancing. We ensure that you're not waiting long, that you get in, you get your physical done, and you get the vaccines that are indicated at the appropriate age. It is so important that people resurrect their vaccine schedules if they stop, to get up to date on those routine vaccines that are not mandated, but recommended at a particular age, along with the flu shot. That's my recommendation. Anything that happens is always worse for us, okay? So those things that we can benefit from, I think we should ensure that we take advantage of it.
And the same things that prevent COVID, I don't mean the vaccine, I mean the measures. The same things that prevent COVID prevent the flu. Wear your mask, wash your hands, watch your distance. Because they came up with those recommendations because of the 1918-1919 flu pandemic.
Correct. That's right.
They work if you do them. But
so one of the challenges in addition, so people are hoping that the masking is going to help, but the other downside is that once people are indoors more, and I don't know if that's one of the factors that's happening in some of these states where it's already starting to get cold, where people are going indoors more, is, let's just face it, those masks and coverings we have, they certainly help, but they are not N95 masks. And so once you're in close proximity and you're indoors, there's going to be other challenges that people are going to have. Because right now, you know, there's a lot of movement for people doing things outdoors. Well, as the weather changes, that is also going to change people's motivation and ability to social distance enough outside. So we're going to see how that's going to have to go. There's issues around ventilation indoors and what impact that's going to have. We're just going to have to see, because I think it's a mixed bag, and you're seeing the different flare-ups because of the same things, factors we've talked before, people and how they are doing social distancing, how they're opening up businesses, whether they're wearing masks, and all the other things that we talked about, and our limited ability still to do standard public health procedures, which is testing and contact tracing for when you start having an outbreak. The White House will not even do the testing and contact tracing that is needed.
It's abominable.
And in fact, they have caused the increase in the numbers for Washington, D.C.
Yes.
By themselves, okay?
And we're still stage 2. We're paying for our compliance. We complied. And now we're all paying the price, right?
And they're holding super spreader events right on
Super spreader. Super spreader.
And he's out there with his mask off, got the people down, downwind, all standing shoulder to shoulder. Will not say when he was tested or not tested, or if he was tested, what the results were. It's like,
Now blaming the Gold Star families for his infection.
Yes, I saw that today.
Ryan super spreader event. I mean, guys, one last thing. Please vote.
Vote.
Vote like your life depended on it, because it does.
And I'm going to say, particularly in those states, if you're in a state that is not so good with in-person voting, or if there's something new, try to vote in person. All of those other states. I mean, California, even though we have a lot of mail-in balloting, it's never been the amount that is happening now. So if people can vote in person, they should, because you're going to have all of these Republican lawyers is coming by to so-called monitor polling stations. Okay, they've employed 50,000 who are going all around the country, who are going to so-called monitor employment stations. I don't know what they're going to do, because there's all kinds of rules around that, but it's a chance, even if you bring in your mail-in ballot, even if you bring it in, if it's going to be decertified because they say the signature doesn't match, or in Pennsylvania, they changed the rules at the last minute. You needed 2 envelopes, and need the security envelope and the regular envelope. You have places in Texas where there's only one place where you can, in a whole county, where you can.
The judge just
ballots.
halted that. They're not going to be allowed to do that according to the judicial order that was just issued last night. So that's the thing. And if you guys are interested, if our listeners are interested in that, you can go to our election 2020 series.
Yeah.
And on our resource page, we have links to the secretaries of state for each of the 50 states, so that you can find out what the regulations are for voting, either by mail or by person in your state. Well, we want to thank Dr. Beverly Sheppard, Dr. Katrina Peters, and Dr. Janice Herbert-Carter for another fascinating set of conversations.
Wonderful.
Thank you all so much for being with us, and we hope that you'll come back on another date and talk about the general
Love you,
health
Janice.
conditions of the
Love you,
Black
Katrina.
communities.
Love you, Michelle. Love you, Ray.
And
Very professional, very
Ray and
professional.
Michelle, thank you for this.
Aren't you glad this is just
This
audio
That's what I
only?
get, guys.
This is audio only.
Well, that didn't take long to go off the rails. So we'd like to thank, on behalf of Wake Up with Nubian Tigers Talk, all of our special guests: Dr. Beverly Sheppard, Chair of the Pediatrics Department for Advanced Care Physicians and Class of 1975, Princeton University; Dr. Katrina Peters, Medical Director of Inpatient Forensic Psychiatry at Zuckerberg San Francisco General Hospital, and also Class of 75; and Dr. Janice Herbert-Carter, Professor of Medical Education and Family Medicine at Morehouse School of Medicine, and she is Class of 1977, for all of their critically important medical insight on the coronavirus and the overall health of Black and Brown communities. We hope that all of our listeners out there benefit from this critical information before you cast your votes this year. As always, we want to acknowledge Mr. Robert Hunter, accomplished musician and composer, for creating the theme music to our podcast. Be sure to join us for our next episode, where we do a post-election analysis on the results of the 2020 presidential election.
If you enjoyed what you heard today, visit our website, NubianTigersPodcast.com. In addition to the podcast, we also post a resource page for each subject to provide additional sources of information. Follow us on Twitter. Our handle is @NubianTigers, written as one word. We are on YouTube on the Nubian Tigers podcast channel. And do you have a favorite podcast service? Well, we're probably on it. You can subscribe to our podcast on Anchor FM, Spotify, Google Podcasts, Pocket Casts, Radio Public, Stitcher, and Breaker. Just look for Nubian Tigers Talk. Looking forward to sharing some knowledge with you next time.
Wake up, wake up, wake up, wake up.